Then another important aspect with respect to the motor vehicular accident is the organ donations in case of the traffic accidents. Particularly, this is basically a evolving side of the medicine where we can utilize these incidences, these cases for the organ donation purpose. As usually the persons, those who are involved in the vehicular accidents are the majorly the young person, so they are very healthy for the organ donation, and it is our lacking, and in different countries it is lacking that we are not able to utilize such a vast source of the organs that may be utilized in cases of the vehicular accidents. So this large potential has to be explored, particularly for the developing countries like India. So here we will be talking different aspects of the organ donation in the medico legal cases, and what are the challenges involved and what are the remedies that could be suggested for to overcome the organ donation in cases of these medico legal cases, particularly the road accident and the burn cases. Because all sorts of the injuries cases, whether it is road traffic accident, burn, hanging, suicidal, or all the sorts of the injuries, accidental, suicidal or homicidal, they are all become the medico legal cases. And in case of the medico legal cases, it is very tedious process, it is not streamlined, so the organ donations are very unfrequently done in the medico legal cases. For the first time, the guidelines for the organ donation in case of the medical legal cases were put under the Transplantation of the Human Organ Act, THOHOTA 1994. So the THOHOTA rules 2024 for the first time explicitly mentioned the procedure of the organ donations or tissues in the medical legal cases. It mentions in the rule 6 that how the medical legal process, organ donation process shall be done. Before going into the detail, I will be asking you, although you cannot respond, but I will be just asking, what is the medico legal case and what is a non medico legal case? Do you understand the meaning of the medico legal case and the non medico legal case? If I ask some of you, you will say that a case of the murder, homicide, or some accident, even most of you might not say that accident is a medico legal case or not. So there is always a confusion. Which one is a medico legal case? Often the medical officers working in casualties has a doubt whether to mark this case as a medico legal or not. Then to clear your confusion that what is a medico legal case, actually the all the cases, first point that I would like to mention that every case you should consider that it can be a medico legal case, because now a time there is no case. If some case you are treating very healthy and he has come with a natural disease process and you are treating, and later on the patient or the relatives alleges of the negligence on the part of the treating doctors, then this become the legal aspect and this became the medico legal case. So wherever, as the name suggests, medical and legal aspect is involved with respect to any case, then this becomes a medico legal case. Normally, a natural manner, wherever the manner is natural manner means that a person is healthy and then he gets some disease because of the infective agents in the environment and other factors. So he, as having the naturally with the time, he has he is getting old, his body is getting weakened, so he is prone to the certain diseases, he may develop the cancers and all those things comes under the medical cases. However, as I told you, if there is comes the allegation in the part of the treatment of not caring properly or the negligence, then they again can become the medico legal cases. Then the another side is the unnatural deaths or unnatural events. Whatever event a person is presenting to you in your clinic or in the hospital, that is not a natural phenomenon. Natural phenomenon means that has been intervened by the human genetic activities, or that has been not been the natural process of the law. Like all the cases you may think, like now right now, whether it is the burning, here it is he was not supposed to burn itself, there is some intervening object outside, or some person was involved, or he has himself put the kerosene and burnt himself, or he got accidentally burned. All those cases will come under the unnatural event. Similarly, the road traffic accident, so he was going and that was not the natural phenomenon. He may have the bikes problem, he may have someone overcross the road, and the means he was not supposed to get those event naturally. So these all, whether it is hanging, suicide, homicide, accidental, wherever the manner, if it is natural manner, that is the medico legal. If it is unnatural manner, whether it is accident, whether it is suicide, whether it is homicide, then it is the medico legal cases. I hope you are getting it now. So all the cases like the suppose road traffic accident, this is the medico legal cases. So in the medical cases, usually the patient is admitted in the hospital, he will get treatment and all those things, but there no police is involved. So there the question of the postmortem examination or the proper investigation is not there. So there is no legal agencies is involved. So doctors can take the consent of the relatives and decide on based on the brainstem death and the appropriate guidelines. They may decide that the organ may be donated or not, and they will be done through the processes in the hospitals based only. However, in the medico legal cases, it is the in all the medico legal cases you have to give the information to the police, and once the police is involved, the investigating officer is involved, he will investigate the method, he will confirm what type of the manner has been involved, who anybody is responsible, any compensation and everything that will be the part of the investigating officers. So here, without the permission of the investigating officer and the proper authorized way, you cannot take the organ from the body. In every of the medico legal cases, if the death occurs, and obviously the organ donation will happen once the death of the person has occurred. And in every medico legal case, the postmortem shall be the routine. The body shall be sent to the postmortem examination. It is another matter that it is a part of investigation. The postmortem may be waived off or not. That is a secondary matter. But it shall be go to the postmortem examination, and the proper detailed postmortem shall be done in all the medico legal cases. Although you may find it a non-futile exercise that you send every body of the medico legal cases for postmortem examination, and this will is unnecessary and the people are not aware about it, they want to take their bodies, they don't want to get the postmortem done. But in my understanding, this is a very important exercise. This is very important that every death shall be properly checked. There should be the death certificate with every death. If there is a natural event involved, then the body shall be sent to the postmortem examination, the injuries and all the patterns shall be confirmed, and the body shall be disposed only after there is the all the examination part has been done. Because justice is very important aspect in a society. If a person dies, then he has all the rights that he shall be get the justice if anything wrong has been done with that person. So it is a very retrospective exercise that we will check our system, that the reason for the deaths, what event has led to the death, and this is extreme side of life. So this shall be decreased. There should be any deficiency that has led to the death, then it should be sorted out. If there is a suppose road traffic accident, it should be checked whether this particular road or this particular area has the frequent number of accident, then you should check for the road plans and everything shall be checked and questioned who has resigned, and everything shall be improved accordingly. So the death based retrospective assessment system can be very well for the society to improve it, so that we can ensure the dignified life for the every individual. Now you must be understanding that in the medico legal cases, postmortem body will be sent for the postmortem examination, and the investigating officer will be involved in investigation and all those things. So it delays the process, and it is very vital in the organ donation. The time is the very vital factor, and the unnecessary time get wasted in this whole of the medico legal procedure. So it is a very challenging for the organ donation during the normally you will be finding that the corneal donation is being done in the cases of the medico legal cases. Otherwise, no any other organ is suitable for the donation in the medico legal cases due to the time factor and the delay happens. There are multiple factors that will be coming to all of them, that is leading to the poor organ donations in the medico legal cases. However, coming to first the transplantation of the human organ and tissue rules 2014, what it says. These rules came as per the provisions of the Transplantation of the Human Organ Act 1994. So this rule number 6 says, in cases of the medico legal cases, after the authority for the removal of the organ or the tissues, as also the consent to donate the organs from the brain stem dead donors are obtained, The registered medical practitioner of the hospital shall make a request to the station house officers or the superintendent of police or the DIG of the area either directly or through the police post located in the hospital to facilitate timely retrieval of the organs or the tissue from the donor, and a copy of such request should also be sent to the designated postmortem doctor of the area simultaneously. So if your hospital has any case where there is a possibility of the organ donation and you have the donor's consent and everything, in those cases the hospital shall make requests to the SHO, SSP or the DIG of the area. They should then arrange for the postmortem examination, and the simultaneously a letter to the postmortem doctor shall be sent. The autopsy or the organ removal will be done in the presence of the autopsy physicians, and he shall opine on the condition of the body, and he may conduct the autopsy at the site of the hospital itself, and thereafter there only the organ donation might happen. But although these provisions had been brought in 2014, but still there is not much increase in this type of autopsy at the hospital itself, and thereafter organ donation still it is in very lower number. Then the rule says that it shall be ensured that by the retrieving organs the determination of the cause of death is not jeopardized. So it is the postmortem doctor who will certify that this organ particular is not required for the cause of death determination, or he will determine cause of death and thereafter he will give the organ for the donation. In this way it may be sorted out. So in this way, for the first time in the medical legal cases, organ transplantation was planned. Then further the rule says that the medical report in respect of the organs or the tissues being retrieved shall be prepared at the time of retrieval by the retrieving doctors and shall be taken on the record in postmortem notes by the registered medical practitioner during the postmortem examination. So as I told you that all the findings shall be noted by the postmortem doctor, and they shall mention what organs were taken, what were their finding and everything in the postmortem report, at what condition they had been donated and everything they should mention in the postmortem notes. Then wherever it is possible, attempts should be made to request the designated postmortem registered medical practitioner even beyond office timing to be present at the time of organ or tissue retrieval. So here even the 24-hour autopsy has got started. So for this purpose, because time is very vital, the doctor may be called for the postmortem examination at any time of the hours, and he should be supporting to the hospital for the organ donation purpose. Then in case of the private retrieval hospital that is not doing the postmortem, they shall arrange the transportation of body along with the medical records and after organ or tissue retrievals to the designated postmortem centers, and the postmortem center shall undertake the postmortem of such cases on the priority even beyond the office timing, so that the body is handed over to the relatives with the least convenience. So in this way the guidelines were formulated for the conduction of the transplantation in the medical legal cases. So as you well understood, all the injuries cases are the medical legal cases, and this may support the lives of the millions. Then as I already told you, the time is the most important factor in the case of the organ donations. We can harvest the cornea up to 8 to 12 hours. So maximum time we have available for the cornea, that is around 12 hours. So mostly the organ donations are practiced in the cornea because of this reason, because 12 hours time it can be approximated and it can be managed that occur at the night or in the morning, and the body is sent for the postmortem examination. Then the organ donor teams they comes and they take the corneal with the approval of the doctors, and in this way the time can be managed in such cases. Now the heart, it is 4 to 6 hours. You can easily think that how slow processes are. So how they will retrieve the organ within 4 to 6 hours of any road traffic accident or other casualties with this complicated legal processes. Then for the lungs it is 4 to 8 hours, intestine it is 6 to 8 or 10 hours, liver it is 12 to 15 hours, pancreas it is 12 to 24 hours, kidney it is 24 to 48 hours, and the bones and the skin up to the 5 years. In this way the different organs have the different time period where we can plan for the donation, and you can very well say that most of organs need to be donated within one day for their proper retrieval and the proper functioning. After that, it is not vital and it will be useless for the organ donation. So the time is a very important factor in organ donation. In India, for the purpose of the organ donation, medical legal cases are rarely used. At best, we are mostly using only the corneal donation in the medical legal cases on the regular basis. In that also, we are limited to the metro cities mainly. Due to non-uniform procedure, legal intricacies, state law and order is a state subject. So different states have the different delayed procedure and the different types of the legal legislations. So it becomes very difficult to organize and uniform the organ donation process throughout India. Even the interstate transfers is very difficult. Practically, the transplant coordinators get difficulty in getting consent and many times unable to harvest the cornea due to the procedure delay. All these factors lead to the poor organ donations in the medical legal cases in present scenarios. Then even in the medical cases, organ donations are mostly conducted in the private hospital because of the not much developed infrastructure and the related development of the medical science. In the government hospital, we are very far behind we are very far behind from the developed countries and many other countries in the utilization of this organ donation purposes. Very limited hospitals have the organ donations. These are also the very top tertiary care centers or the apex institute. There only the all the sorts of the organ donations are done. So as the majority of the transplantation procedure are done in the private hospitals or in the apex institute of the government, they are rarely involving the medico legal cases for the transplantation purpose, either due to the lack of clarity of the procedure and the administrative reason and other unclear reasons like the consent issues and other issues. For those reasons overall the organ donation is very poor in the India. The most important difficulty that appears before the organ transplantation is the difficulty in declaring the patient brain stem death. Again, in the case of organ donation, we have to follow a certain guidelines, Minnesota criteria of brain death certification that is presently followed as per the THOTA 1994, that is Transplantation of Human Organ Act, and that is very tricky and that is very complex procedure that itself takes the 12 hours of time that you have to wean off the person from the ventilator and you have to look the whether the person's vitals are normal or not, and thereafter you have to confirm the brain stem death and then you can take the donation. So the vital period get wasted in this brain stem death certification, and for that matters it is very impossible that we can plan for the organ donation. However, normally in the routine practice, a patient is declared brain dead or the brow dead only by the examination of the absence of the tripod of life and brain stem reflexes in one sitting and the bodies are getting cremated. This is usually happening throughout India, that the body in the peripheral centers or the most of the hospitals, the body is being examined by the single doctor who examine for the corneal reflexes, dilatation of the pupil and all those signs after the death of the person. Then he certifies the death of the person. There is nowhere that the patient is sent on the transport on the ventilator because all the hospitals even don't have the ventilators. So the most of the places the death is declared by the single doctor and he certifies the death. However, in case of the organ donation, as it becomes a cumbersome process and it has been under the check of the legal system, so here it is very important that you have to get certification of the brain stem death. So the now question is how you will get the brain stem death certification. So this becomes a very tough task to decide the brain stem death and take the organ donation. This, I suppose that this is one of the major challenge in the organ donation system. Further, in cases of unknown bodies admitted in the hospital where organs can be suited for the donation are not allowed due to the legal obstacle of the keeping the body at least 72 hours for identification purposes before the postmortem and the last rite. So in the routine practice, or it has been the law that for the purpose of identification you have to preserve the body for at least 72 hours and then you have to in between you have to take the appropriate measures like publication of the picture of the body in the two newspapers, and you have to make the all the attempts, you have to keep updated on the site about the identified bodies, and thereafter you have to wait for 3 days to look if any claimant is there, if any relatives take the response, take the note that the person belongs to him or not, and thereafter only the post-mortem examination are started. Once after 3 days at least, that they will go for the post-mortem examination even, and then the further they will be cremated, even if it is they are not identified. So in this way, the process in the unknown bodies are followed. So no one can take the organ before the 3 days. It is impossible. So this, for the unknown cases, we cannot collect the organs for the donation purposes, because anyway 72 hours most of the organs get petrified and they are non-vital and they cannot be utilized for the donation purposes. So this is another challenge. So now you can see the challenges what we have before the organ donation systems. Then, as we already talked, the most important area where organs can be suited for donations, particularly in the medical legal cases, could be the accidental sudden deaths, like the burns, road and railway accidents mainly. More than 1.5 lakhs people die alone in the road traffic accidents. More than 1.5 lakhs people die alone in the road traffic accident, that also in the young age group in every year. They can be the potential donors for the organ transplantation, but due to the improper medical legal, but due to its becoming the medical legal case, issues of the consent and the delay on the transfer to the hospital and ignorance of the people, we are unable to utilize this for the better purpose of the transplantation. So to improve the utilization of the organ donation in the medical legal cases, we need to first tackle the basic issues that is common in general. So to improve the utilization of organ donation in the medical legal cases, we need to first tackle the basic issues that is common in the general for the organ harvesting system in India, and utilize the existing law of the organ, and then utilize the existing law in the organ harvesting process in the medical legal process. The law that has been, rules that has been drafted is fine, but there is need to streamline, or but the need is to tackle the organ donation system in the non-medical legal cases, like the issue of the brain stem death. These all shall be sorted out, then only we can think on the medical legal cases. So first step is to improve the medical donation, the cases with the medical donation, and then we can apply that system, improved system for the non-medical legal donations. Further, we can bring the reform by focusing on the unknown bodies and accidental deaths among the medical legal cases by modifying certain laws. In this way, we may think of improving the system of the organ transplantation, and we can promote for the organ donation. Then the issues and the challenges, if I